Moving on to our next speaker, I would refer her as the Ozone Woman of India. She is none other than Dr. MILI ARPAN SHAH, President of Ozone Forum of India and Trustee at Bisleri Charitable Trust. She's a practicing homeopathy and psychotherapy since 25 years. She's also practicing ozone therapy since 18 years with charitable institutes and hospitals, has conducted 84 training programs of medical applications of ozone therapy, arranged
101.
here. Yeah, Dr. Mili? Yeah, arranged 12 national conferences for benefit of ozone therapy in clinical practice. She works in the field of cancer, pain management, and chronic conditions with ozone therapy, homeopathic medications, nutrition, and environmental support. She is promoting ozone therapy across India. She has started Ozone Forum of India clinics as well in Mumbai and Kolkata. Her topic for today is insights of ozone therapy in preventive medicine. Over to you, Dr. Mili. Please share your wonderful insights on the same.
Thank you. Thank you, Karishma. Thank you. Just a moment, huh? Okay.
I can see your slide. Can you
you can see the screen?
Yes, I can see the screen. Can you please slide show it?
Yeah. How do I?
Yeah.
Okay, can you still?
On the, yeah. The same button. Could you please click on that?
Yeah. Okay. Thank you, Karishma. Thank you, Preeti, for adding and inviting me. Just a moment, just one. Somebody is just. Okay. So today I'm here to talk about insight of ozone therapy as a preventive treatment. The ozone therapy is also an oxygen-based therapy. It can be also considered as bio-oxidative therapy. There are multiple names, but what works is that ozone molecule, and it is an extremely beneficial molecule. We will be talking about ozone therapy, the scientific update, insight of ozone therapy. First of all, I would like to thank Preeti for inviting me on this lecture series, that is in Indian Association of Functional Nutritional Medicine, and you all are doing wonderful job. I see a lot of people attending this conference, and I'm very happy to see that so many people have now looking into integrated space for the treatment and for improving their lifestyle and biohacking their own
Thank
health.
you, Dr. Mili, for being here.
Thank you. Thank you. Thank you. So before we move ahead, I would just like to say who are we? We are a group of doctors who practice ozone therapy towards betterment of human life and energize your life with active oxygen. We are in the field of ozone therapy since last 20 years, and we've been promoting ozone therapy since last 20 years as a cost-effective, beautiful complementary therapy which can go in hand with any treatment. The relative simplicity of ozone therapy and coupled with low potential of severe side effects makes it very attractive adjuvant therapy for number of health conditions. And when we talk about ozone therapy, it is always a life-giving and life-sustaining oxygen comes along with it. So when we say ozone is used for oxidative stress, we look at oxygenation and oxidation both. So usually when you have a lack of mitochondrial decay, the disease is produced. When you have lipid toxicity, high glucose, inflammation, ischemic cardiomyopathies, and lot of cell signaling decaying, so that's where you have lack of glutathione reductase peroxidase, intracellular or enzymatic antioxidant defense mechanism, and that's where the mitochondrial antioxidant system fails, and that leads to production of lot of ROS, RNS, hydroxy radical, and this leads to lipid peroxidation, and that's the oxidative stress which we say is the origin for almost all non-communicable diseases. And ozone therapy improves them by improving your intracellular defense mechanism. So when we talk about ozone, a lot of people ask that is it a new therapy, which I would say completely no. It is not a new therapy. Way back in 1911, ozone was published in Lancet Journal in Loyola University, Chicago also put forward the use of ozone to treat tuberculosis, anemia, chlorosis, tinnitus, whooping cough. And today, in World Federation of Ozone Therapy, there are multiple countries, more than 22 countries, which practice ozone across the world and making it available for patients. So, ozone, which is, we call it a oxygen ozone therapy. Ozone is a molecule of 3 oxygen atoms. It is 99.5% to 95% oxygen and 0.5 to 5% ozone. It always leads to oxygenation and oxidation. And this energetic extra nascent oxygen, which is coupled with O2, is what makes the whole therapy very active. When ozone is given inside the body, what it does is the dissolves in plasmatic water, and PUFAs are the first target. This is polyunsaturated fatty acid in interstitial fluids, and it forms a gradient of H2O2 and 4-HNE, that is 4-hydroxynonenal. It is immediately uptaked by erythrocytes, and which is the nucleated cells, and enhances your NRF2 pathway, inducing the antioxidant response element. And when you have antioxidant response element is induced, you have increased SOD catalase, glutathione reductase, peroxidase increased. At the same time, there is improvement or what we call it immune modulation, which is decreased in IL-1, 2, 6, 7, and tumor necrosis and TNF alpha, and whereas increased in IL-4, 10, and 13, and transforming growth factors. So when we give ozone therapy, it modulates your immunity, neither suppresses nor stimulates, and that is the beauty of ozone when we talk that it improves your autoimmune condition. When we want to use ozone therapies, different application, you can use it as a chemotherapeutic agent and pharmacotherapeutic agent. So when we talk about chemotherapeutic agent, all external applications are used as antiviral, antibacterial, antifungal, and these improve your infection load, or it reduces your infection load. Whereas when you give ozone therapy systemically, it enhances your hypoxia. Anti-hypoxic, it is anti-inflammatory, immunomodulatory, and at the same time, metabolic enhancer. So all systemic applications, which are major autohemotherapy, which are vaginal and rectal insufflation, IV ozone saline, these are used as pharmacotherapeutic agents. So you can use ozone therapy in multiple different ways for giving the right result which you want in your patient. Ozone's therapy target is erythrocytes, which improves your oxygen delivery, leukocytes, which improves your immune activation, platelets, it improves your autokine and growth factors. And the late phase of ozone therapy, when it starts working on your endothelium, which modulates your nitric oxide, on bone marrow, it enhances or it forms better metalloproteinase MP9 and favors the release of stem cells. At the same time, it upregulates your antioxidant general system. So many a times, when you give ozone therapy, you do not really need the lot of supportive, applications along with it, but it can be combined very well with any treatment modality. So when we say when ozone is given, it works on intracellular antioxidant defense mechanism. But if you have a nutritional deficiency, ideally you must enhance or improve or substitute, supplement, or use therapeutic nutrition to treat that condition along with ozone, which will enhance the result of all your treatment rapidly. there are 6 biological properties of ozone, which I just recently, just now I explained. When we give ozone therapy, it upregulates your prostaglandins, improves your metabolism, regulates your oxidative stress, immune modulator, metabolic enhancer, and wide spectrum germicidal property. So, ozone therapy improves your antioxidant defense mechanism. So, when you look at any oxidative stress disorder, what you need is improvement in antioxidant defense mechanism. So, ozone by and large improves your intracellular antioxidants. At the same time, it improves your immune response towards inflammation, better circulation with increase in 2,3-DPG, so which helps releasing more oxygen at the tissue level. So, ozone enhances your heme oxygen curve. This is very well published in with diabetic with the chronic renal failure model with rats. Basically, animal study was done, and where they gave rectal insufflation, and they saw that all the CRF was created on these rat patients, and when they gave ozone therapy, you are improving all the and antioxidant defense mechanism. At the same time, you reduce the plasmatic creatinine, you reduce protein excretion, urine excretion index was also better. So, ozone therapy improved or works as a preventive for people who are prone for cardiac or renal failure patients. At the same time, ozone therapy can be a very good stimulation to antioxidant defense system, which was also done in a rat model. Ozone therapy in ischemic cardiopathy was given as a major autohemotherapy, and the science behind it is that it enhances your antioxidant defense mechanism, but at the same time, it improves your tachycardia, anginal pain, dyspnea, sleeping problems, vertigo. So it works on a holistically on all the quality of life symptoms of ischemic cardiopathy. At the same time, biochemistry also is enhanced. When you use ozone therapy in arterial insufficiency as major autohemotherapy, that also enhances your glutathione reductase and glutathione peroxidase is increased and melandyloids are decreased. So lipid peroxidation will be reduced. So the ozone works on both ways, improve antioxidants and reduce the lipid peroxidation. Superoxide dismutase behavior at the beginning and at the end of ozone therapy in different disease. So if you have asthma with glaucoma, Alzheimer's, optic atrophy, what you need is a good SOD, which will enhance or make sure that the disease progression is controlled, and it can improve your antioxidant defense mechanism. So this was also observed. With the red blood cells, as I was mentioning, ozone improves the heme oxygen curve. So it enhances the oxygen delivery. The microcirculation can be improved with ozone therapy. So when you look at cardiovascular diseases, the main problem is ozone works on RBCs, and it enhances your oxygen delivery to the tissue level, which improves your basal metabolism and reduces your cardiovascular diseases. At the same time, ozone increases the endothelial progenitor cells, increase growth factor, VEGF also enhances, and it improves your immune system activation. So this was the computed tomography where we had done for our patient, where the pre-ozone, the brain blood flow, we saw that was 80 to 60, whereas after 3 sessions of major auto, we saw that the blood flow perfusion was increased to 100 to 90. So this enhanced the oxygen circulation. It is a very powerful antimicrobial tool. The one important way of ozone working, as it is a selective and can work on all lower life forms by destroying the lipid matrix of the virus, and this enhances the load of also it reduces the load of infection. At the same time, it is used as a complementary supportive therapy with any infection condition. So when we look at ozone's bactericidal property, it down-regulates the response to viral replication and it down-regulates the response to multiplication, whereas up-regulates your immune recruitment cells and it antibacterial response also. So when you take ozone therapy, it enhances an antimicrobial property. So your body can fight against any disease much faster. So this was the Borrelia infection before ozone saline. And after ozone saline, you can see that there is complete reduction in the infection. Candida before and after ozone treatment, IV ozonated saline. This is live blood analysis of the patient's blood, and fungus on mold infection before and after ozone therapy, and you see that it enhances very well. The clumping also reduces. There are a lot of publication which tells that if you combine ozone therapy along with any antibiotic which you are giving, it can intensify the result of antibiotics. So it can be a very supportive treatment along with any infection. And it can be used for superbacteria as methicillin-resistant Streptococcal aureus also. Ozone therapy has showed very good results along with abdominal surgical procedures to reduce post-operative morbidity and mortality. So this is the diabetic foot which I wanted to show before, which had so much of infection, and after 10 days, you see complete reduction of the infection. At the same time, you see the circulation you see the circulation enhancement. So the healing becomes much faster when you add ozone therapy for any non-healing ulcer wound. So when you want to heal tissue in dermatology, you can use ozone in systemic and topical. In systemic effect with platelets, it improves VEGF, prostaglandins, and transforming growth factors. Whereas locally, it works as an hydrogen peroxide gradient and improves and reduces infection. So this is the Pseudomonas infection, first sitting and in 9 months completely healed Pseudomonas activity. With white blood cells, induction of cytokine, interferons, and interleukins and growth factors are seen. So ozone enhances the work of white blood cells in such a way that it is an immune modulation. It works through lymphocytes, monocytes, and neutrophils. This together enhances modulation, neither suppression nor stimulation. So it can be used in a immune compromised patient, at the same time autoimmune patients, both ways. Only the concentration which you need to choose with ozone therapy is a different part. And here, when we see before and after ozone therapy, all your cytokines have enhanced, balancing each other, having immune modulation, which works on both ways, humoral and cell-mediated immunity. Ozone's interesting part is that it enhances the prostacyclin effect. So it works very well as a vasodilator, anti-metastatic, and anti-inflammatory. It inhibits platelet aggregation. Ideally, you must diagnose the oxidative stress on patient. So you can calculate all the 8 biomarkers of glutathione reductase, peroxidase, SOD, catalase, T-bars, and THT. You can find all the range, and then you can find the oxidative range of whether you have light oxidative stress, moderate, or high grade. This you can find by checking the cells and the plasma and the erythrocytes. This can be available in major cities. We in Mumbai have glutathione reductase peroxidase, tie-up for checking the blood of oxidative stress in patients' blood. So when you give ozone therapy, we can give from cough, cold to cancer, from prevention to treatment, from anti-aging to circulatory disease. It can work on everything because by and large, it's an oxygen therapy and works on the every cellular. So oxygen, which is the most forgotten nutrient we are trying to replenish that in a therapy way. If you do yoga, it will be extremely beneficial, extremely good. But if you cannot, okay, you can do ozone therapy. The right way of doing ozone therapy is finding a systemic application which is effective and minimal. So minimal, why? Because you don't need to do anything which is more the merrier. We need to have an effective solution and minimal dosage. So when we talk about ozone therapy, there are also contraindications. So since ozone works with RBC mechanism, G6PD deficiency is the main contraindication for IV ozone. Hyperthyroidism, thrombocytopenia, serious cardiovascular instability, convulsive state are also a big precautions and contraindication for ozone therapy. The systemic application, when you want to give ozone therapy, you have to combine local with systemic. So when we talk about ozone therapy, you can give either in major and minor autohemotherapy. Intramuscular ozone injections work on the whole musculoskeleton. Ozone saline improves the circulation, and rectal ozone, which works on systemic application, improving your liver detox. So when you take ozone therapy, it can be by and large given as one systemic and one local treatment. So when we do any protocol, we usually have a basis on eliminating waste, regenerate the liver, reactivate your immune system, restore the enzyme, minerals, and hormone system. So we enhance our body's ability to eliminate toxin and residual accumulation from the environmental sources. So we usually do rectal ear ozone water. You can also do ozone steam sauna once in a week, which will also improve your general well-being. Major auto, minor auto, and depending upon the patient's requirement, you can choose your application. So, ozone can work on preventive as well as treatment modality for the patient. I think I will stop here. If I have time, I can go ahead, Karishma.
So basically, we have 3 more minutes to go. You can go for 3 more minutes, ma'am. Yeah. And we can take up one or two questions just. Yeah.
Yes. So the preventive work, right? Everybody wanted to, I mean, today, I think Preeti had given me how it works in prevention of the disease. Okay. So
Thank you.
yeah, so why I wanted to prove this is proven. We have done it on 320 employees of a Bisleri factory. During COVID-19, we wanted to boost the immune system so that they don't contact infection of COVID, because um, we were essential service. Okay, so ozone therapy we gave as a minor autohemotherapy, and we just did B12 and T3 intramuscular injection, 2 sessions. So 8 sessions of ozone minor autohemotherapy, which works as an auto vaccination. Okay, and B12 and D3 to replenish the nutritional, because these were all social low economic patients where we really don't know their nutritional status, and we didn't have time to check the B12 and D3. This was proven on 320 employees. And the other one, which you can improve your own self by taking ozonated steam sauna. So most of your toxins are stored in your lymph and on in your fat tissues. If you do ozone steam sauna, so steam which will open up the pore, and ozone when absorbed, it will have a detox, and it will improve your circulation. Skin being the largest organ of the body, you can have a wonderful detox with ozone steam sauna. And this works extremely well in improving your general well-being. You can add infrared to this, you can add sunbathing to this, you can add, drinking a lot of sun-charged water. Add any more thing in it, but these two applications, which is minor autohemotherapy and ozone steam sauna, works extremely well for your own, improving your own immunity, and you can take charge of your own body and improve. So this is how ozone helps in the steam sauna. I think I will uh, quickly, okay, I think. And the third one is ozone rectal, which improves your liver and enhances your portal venous system. I think any questions, I think you can take from there.
Thank you.
And I'll
Thank
be
you.
happy to answer questions outside in the IFM group also.
Yeah, thank you so much, ma'am, for sharing your insights on ozone. And we all know that how it is becoming an important tool to, rectify many of the chronic disorders in the body. One question, there are two questions just. One question is, what is the cost for per session when it comes to IV ozone?
Okay, this varies from doctor to doctor and the setup to setup. In
Yeah.
our clinic, which is in Andheri, Mumbai, we are supported by Bisleri Charitable Trust. So our sessions are very, very cost effective, say 1,000 rupees per session. You
Mhm.
need to take at least 10 to 15 sessions. You can go to any private doctor. I think they would take somewhere 2,000 per session. And it should help, and it works for 6 to 8 months. So it's not that you take session and it wipes off. If you take accumulative result of ozone, it lasts you with the RBC's lifespan. So
Oh,
you can do basically 120 days, it can remain. And if you do few of the maintenance dose, then it can go on for longer. We suggest our patients to take um, ozone treatment 10 to 15 sessions once in a year. That should be helpful for detox. And I'm talking about prevention, not the treatment.
yeah.
So it should help in prevention.
Second question is, can ozone as the modes of, route of administrations that you have shown, can ozone be nebulized for lung infestations as well, in a nebulizer?
So the, ozone is not a nebulizer. You cannot inhale ozone directly because your respiratory epithelium cannot take the onslaught of ozone oxidation process.
Yeah.
We give ozone, that is breathing ozone through oil. In that, the oil medium, when comes in contact with ozone, converts the pufa of it into terrapin gas, and
Mhm.
that you will inhale. So oxygen plus terrapinoids, which is a molecule of ozone plus pufa of the oil, and that can work extremely well for long COVID, for lung diseases, for allergies, for asthma, and many more. So it is not a nebulization, it is called breathing ozone through oil.
Breathing ozone. Okay.
You can
Thank
take nebulization of H2O2 though, works
Yes.
similar,
Yes.
but different way.
Thank you so much, ma'am. Those are the only questions that people have for right now. And thank you
Thank
for
you.
joining us as a speaker. Thank you so much.